But enough about myself. Let's talk about C-Notes. And thank you guys for coming again. Believe it or not, whether you know it, we've been out since February of this year, and you guys are early adopters. If you choose to venture into C-Notes, you will be an early adopter because we're just beginning this wonderful journey. So what's the big deal about going paperless? Are we making the world a better place, saving trees? Well, actually, this lecture is not about saving trees. It's not about going paperless. It's about writing beautiful clinical notes, because as we all know, we don't feel like we have enough time to write beautiful notes. And if we do, it gets in the way of our production. And in that way, it doesn't make our world a better place. So what we want to do is concentrate on creating beautiful notes for our patients. And the reason why we started building this product is because we realized that, if I'm going to write a great clinical note, I either have to narrate it and with dictation, which costs a lot of money. Plus, if you dictate with Dragon or something like that, it requires a great deal of editing. And so with that respect, plus you have to think about your sentences and composing, which is a big problem, because by the end of the day, you're very tired. So what we did was we created a product that we felt like could help our environment, both clinically, but most importantly with the clinical practice management. So for 20 years, digital technology for clinical dentistry has far outpaced the digital technology for clinical practice management. And you say, well, that's obvious. You have implants, you have dental x-rays, digital x-rays, all these things. But when it comes to practice management and how we relate this information, this patient information that we so desperately want, you find a lot of it's not in your practice management. So we're going to cover that real quick before we get into C-Notes, so you'll have a better understanding why this product is so important. So let's do a literature review and discuss some things. In 2009, a Harvard medical study, they reported that computer medical records were really not improving the efficiency and quality of care in healthcare offices in general. And there seemed to be a disconnect between the practice management uses of electronic dental records and what the doctor's clinical desires were. So there's this big disconnect, and it's still in effect today. It's gotten a little bit better, but very, very slow in changing. Now, why do practice management softwares not get into this? I really don't know. I wish I had a good answer, but I guess what they think is what they do is useful enough. But doctors, what they really want is something that shows the clinical aspect of their work. So the reason for this study and what they produced was practice management software is designed primarily to handle billing, accounting, and registration needs, but not clinical needs, which we still see today for many purposes, but it is getting better. And what we hope to do in the long term is integrate with practice management software, so it becomes even easier, because we do see there is the ability to do so. So in 2010, the Journal of American College of Dentists, Larry Emmett, dentistry's high-tech guru, he says electronic dental records offer fantastic benefits, saving both time and money, but they have to be fully implemented with only historical records kept on paper. And it's like, really? Come on, Larry. But what you realize here, and what he realizes, part of his brilliance, is the fact that he recognized back then in 2010 that there are limits to practice management software. And that limit happens to be right where he says, at the clinical interface. So Larry, once again, proves to be true. Titus Schleier, DMD, Center for Dental Informatics. Titus is, I would have to say, one of the most researched people when it comes to practice management and clinical interface and things like that. And he is the go-to guy. He knows more about the future of how this is going to be. So despite decades of research, he says the adoption of health information technology to improve patient care has been slow. A critical reason for the slow adaptation is the poor usability of clinical systems. So the things that we want the most, the dental history, the medical history, treatment notes, chief complaint, they're what's stored most least in practice management software. So This is what, in essence, brought about the beginning of C-Notes. So the study just reinforced the need to apply what we call cognitive engineering methods. So I want you to remember that word, those words, cognitive engineering methods, because I'm going to come back in just a little while. So this clinical information interface, this relational information that we need to improve patient care, is what we're so desperately looking for. And essentially, to put this information into practice management software currently, it's an arduous task because it demands that we type. I don't know about you, but I'm a hunter and pecker. I don't type all that well. And for me to type pages and pages of notes for a single patient would literally take me 20 minutes. So, so what kind of advanced techniques has practice management software come up with? Well, we have rich text format, which when you go into your practice management software and it says clinical notes and you're going to type in your clinical notes, that's being typed in rich text format, which is a little bit better than a typewriter. It's all it is words, doesn't allow images or anything like that. You can also have templates, and we'll discuss that in a minute. There's also dictation, which I just discussed, can have a lot of issues with editing and inaccuracy. So what we really want is a paper chart in for our practice management software. The paper chart is tried and tested and true, and this is the kind of information that we expect in our software. But do we have it? No, we really don't have it yet, and that's why, once again, C-Notes was built. If you look at something, what you really are looking for, that's the information that's in the paper chart, is the BDR, which stands for Baseline Dental Record. And that's the information that we want to enter to be able to relate to with regards to the patient. So Titus, what he came up with was in this graph that you see, he came up with the baseline dental record. He's the one that created this language. And if you can look real closely down at the bottom, you'll see appointments, treatment plans, completed treatments, oral health status, intraoral images, extraoral images, diagnosis, radiographs, dental history, medical history, progress notes, and chief complaint. And what's in green is what is in practice management software. And you notice things that are appointments and scheduling and treatment plans, that's all placed in practice management software. But things like chief complaint are not in as much. And what's in the dark blue is kind of like what's in between what is placed in two places, what's placed in practice management software and in a paper chart. So you see there's a lot of overlay of information. So what are the drawbacks to having this overlay of information? Well, it consumes unnecessary resources. It takes time. You can create clinical errors with it. You know, did you put the note here? Did you put the note where? And it may cause legal complications. For example, it could be inaccurate treatment diagnosis or inaccurate diagnosis, et cetera. Many things can happen because of the cross information patterns. So why the duplication? Well, when asked in this study, most dentists would say, I'm in transition from paper to paperless and from going from a chart to a digital software. Now, I will tell you, in my practice, I am in transition. I've been in transition for 20 years, but it's kind of like where we are today. I still like having a paper chart, and I will tell you, I still print C-Notes. There's no doubt about it. C-Notes prints really great. I like having a tangible chart in my hand when I'm looking at the patient. It allows me to hold it in my lap. I can actually look at the patient and talk to them as needed. And also we have it in the computers, but I like it in both places. So there's nothing wrong with that. So as we say in our ads, printed or digital, they're notes made easy. So we want to, the whole point here is to write detailed notes. So the other thing about this duplication, when asked, why do you have duplication? Many responded. The second most important reason was my practice management software is inadequate. Now, it's not a criticism of practice management software. It's just saying, look, my practice management software is not giving me that clinical interface that I really am looking for. But it's getting better. So those are the two main reasons. So the study results say today's electronic dental records do not mirror the information content in the paper chart. So if we look at a baseline dental record, what do you have in practice management software? Well, you have registration, you have appointments will be found in the scheduler, you'll have treatment plans, That'll be found in a ledger. You'll have completed treatment, which will be found in a ledger. You'll have intraoral images, which will be found in attachments. You'll have radiographs, which will be found in attachments. Charting, what they're getting better at, will be found in a chart module. Most chart modules are really, really good, and they tie right into the treatment plan. So we like them. Remember, we're not a charting company. We write an incredible dental note. So alerts can be found in forms many places. Oral health status will, and most times, be found in a paper chart in the notes. And so will diagnosis will be found in the notes. And so will radiographic findings. Even though you take a digital radiograph, you're going to write about the findings in your notes. And examinations you're going to conduct in your notes. And dental history you're going to take in your notes or in some health form. Medical history updates will be found in your notes. And medications updates will be found in your notes. So you see what the clinical interface that's missing. Prognosis will be found in notes. Prescriptions records can be found in 2 places, but mostly notes. Consultation discussions will be found in notes, and we're going to cover that in just a moment. Informed consent is found in notes, and also treatment notes will be found in notes. So you see, in a chief complaint, one of the biggest things that we need to record. And then what else is in there? Well, there are many other things, but these are the baseline dental records that you should be looking for in your paper chart and in your practice management software. This is the basis for creating an interactive dental chart for your patient, clinical management tool. And so the promise of technology, well, we want to better mimic the paper chart. And by incorporating more baseline dental records into the electronic dental records, it's going to allow us to get more fully into implementing a complete EDR into our practices. And that's why we created C-Notes, because we tried to become the missing link of where PM software is not happening. So it's about being patient-centric is the way we believe in our mantra. So patient-centered information from the clinical interface. And so other promises of technology that we want patient-centered software is the most important thing that we want. So, with that being said, let's move on to template writing. So as you know, it's one of the tools that practice management softwares have created in order to allow you to write nice notes in an efficient manner. But there's some issues with template writing. And this is another reason why we went in and created C-Notes. Is it a good solution? Well, the answer is, simply put, templates are not a reflection of what transpired between you and the patient. It's simply not. So there can be a lot of issues with templates. It raises some serious ethical issues also in the credibility. Did you actually write this note? Or did you actually do these procedures to the patient? Or did you just take some sentences and copy and paste some things? How accurate is this note compared to what you really performed? And this kind of thing propagates errors, because you can get in habits of doing, writing having the wrong information of what you actually concluded for the patient. And also, it becomes a primary question in legal depositions. Today, if a attorney, let's say you're being deposed, an attorney sees this beautifully well-written note that's typed, and he's going to say, how do you write your notes? And you're going to respond very proudly, I use templates. And he's going to say, well, and then he's going to proceed to, he's going to want to tear apart every line that was written and asked if you performed these procedures. Did you do this? Did you do that? Etc. And sometimes it may be contraindicated, your notes, as to what happened when the patient gets reviewed by a second opinion. So it can cause some really serious problems from a legal deposition standpoint. So what about malpractice? Well, this is another reason for C-Notes. You will contend with 3 to 5 legal issues in your career. Yeah, really, you really will. So progress notes and consent forms are the first line of defense. Notice your practice management software. Your registration form is not a first line of defense. Your ledger is not the first line of defense. It's your progress notes and your consent forms. So that's the most important. These are the things you should be capturing. You should be capturing them better than anything else. So what we like to think is that we practice proactive malpractice prevention. What does that mean? Well, our mantra for this is, I don't worry about getting sued. I plan on it, because, like they say, you'll probably have some kind of legal issue 3 to 5 times throughout your dental career. So what about informed consents? Very important. You have to have them. That's why C-Notes has them. But most informed consents that you have are simply a piece of paper that says, we perform these things, and the patient has to sign it. And the patient doesn't know about all this stuff. So, but in a true disclosure, according to Edward Robb, MD, and a JD, Parameters for Informed Consent, he says that disclosure is very important, and the patients must be told in detail a couple of things: the nature, the risks of the treatment, the benefits of the treatment, alternative treatments, complications that could come from the treatment, and recommended treatments, more than one. So these are the things that should be in informed consent, and that's what we do with C-Notes. We actually create an interactive consent form that is based on the consultation that you just gave the patient. We can cover that in just a moment. We're going to be writing some C-Notes in just a minute, but I need to let you make sure you see this. So look at bridging the gap, turn thoughts into EDR. Human interaction with technology makes dentistry easier. That's what we want to do. These are all cognitive engineering methods. These ads are nothing but about cognitive engineering methods, making that clinical interface better. So I believe the ultimate goal of dental technology is to reduce the complexity of daily activities, okay? And that's what these ads are all about. These are the guys that started C-Notes. On the right is Scott. In the middle is Jorge, and then myself on the left. These are the cognitive engineers. Scott's very bright, brilliant. Jorge's a brainiac, and I don't have a clue. Anyway, I like to show that. Anyway, let's write some C-Notes. And now when you first look at C-Notes, I want you to realize this is a very big app. It takes time to learn how to use. One of the things that we see with people who first get the app, because we do offer it on a month-to-month basis, but what they will do is they will get it. I'll reach out to them and say, let's have a little consultation. Let's talk about this, because it's just like learning, when you first got Microsoft Word, did you know how to do PowerPoint? No, it took a while to learn how to use it. You had to go, take classes and look at tutorials and all that kind of stuff. And it takes time. Same thing with C-Notes. Too many times our clients, they come in and they get a little frustrated with it. And it's like, no, you shouldn't, because you're learning how to use this product. I will tell you, I've written thousands and thousands of notes already on this app. And, and I know this app better than anybody when it comes to its layout, as far as telling people about it. And that's why I'm the one that is basically telling people about it today. But it does take time, but once you learn your pathways, it becomes easier, and you don't have to be as intimidated from it or frustrated. So I highly recommend that if you get it, I want you to schedule an appointment with us. It's one of the things that we do as being hands-on, and want to make sure that you have the best experience with it. So let's go ahead. I'm going to get out of the lecture just for a moment, and we're going to get into, let's see, I'm going to switch avenues here. There we go. Hold on just a moment. Let me get into a simulator. And there we go. Okay. So here's our simulator. Now to get into C-Notes, we're going to type in 3 pieces of information. Our patient, we'll just call him John. Initials of the person writing it. You can change the date if you want. It automatically is for today. And let's do something. Let's see, let's do some prosthodontics today, because that's seems like that's what I wrote most of this week. And we're going to say we're going to do, let's do crown prep 8, 9, and veneer prep let's see, 4, 5, 6, and 10, excuse me, 4, 5, 6. See how fast I type, guys? 4, 5, 6, and 10, 11, 12. Is that right? 8, 9, 10. Well, let's add some teeth here because I will tell you this, and I'm speaking. Let me go back here just a little bit. 4, 5, 6, and we're going to do. No, that's right. 4, 5, 6, and 10. Good. 10, 11, 12, 4, 5, 6, 7. That's what I'm missing. And 10, 11, 12, and we're going to go to 13. Now, normally I will tell you that if you're going to do cosmetic work, and we're going to do a makeover, which is what we're doing, you want to never end at the social 6, at the canines. As a master ceramist, I'll tell you, you either want to do what shows in a smile, which goes all the way back to the bicuspids, or you do what goes within the incisal plane, which are the canines. So you always work either 4 or 10. That's my rule of thumb. Anyway, a little pearl I gave you for prosthodontics. Let's go in the prosto. So you can see here in the top, we have all the treatments of dentistry except for sleep apnea, sleep disorders. We have exams, operative, endo, prosto, ortho, hygiene, pedo, facial aesthetics, which is lips and Botox, fillers, TMJ, TMD, which is very strong in assessment there, oral surgery, implant placement, and periosurgery. And they're very similar with regards to bone grafting and things like that. Anyway, so we're not going to go into surgery today. We're going to talk about prosthodontics. So let's click on prosthodontics. You'll see in every department, you're going to have a treatment selection. Now, the way C-Notes is written, it's written in such a way that, let's say, for example, you thought, well, I want to talk about crowns today. And a lot of people say, well, why don't you just go to crowns? It's like, well, because what you're going to see in C-Notes, we go through every procedure and every possibility through every procedure, so you don't have to go looking around for it. But what we're going to do here today is we're going to hit crown, and we're going to say 9 and 10. So we're doing 2 crowns, and it says at the bottom, additional treatment selections. Let's go ahead and hit veneer, and we're going to start 4, 5, 6, 7, 10, 11, 12, 13. And now that we have those lit up, we hit done. Now you can see we have 2 treatments that are being presented, one for crown, one for veneer. So let's go ahead and start in crown. And the way C-Notes is written, as you can see, it leaves a little paper trail where you can see the prosto is grayed out. The highlight is in crown right now, so that's where you're working. And then below that, you'll see all the elements that can be, or activities rather, that are in the crown procedure or crown treatment. And so here we go. When you look in here, you can see we're able to scroll, and that's everything that you're capable of doing in a crown prep. Now, so when you see this, we have, notice we go left to right and top to bottom. So when you go into, first thing you're going to start off is on the left, and we're going to open up the pre-op side, and you'll see we have conditions, vitals, review med history, pre-med, anesthesia, preliminary impression. These are things that happen before you get started preparing teeth. So let's, we're going to skip conditions, but just to show you real quick, these are what conditions look like, and we can get into all of that in a little while, because I think we'll have enough time to do an examination also, and I'll show you that. Anyway, vitals, if you want to record vitals, we'll put 120/80 or BP, and let's say he's a little nervous, we'll put 68. And we hit commit vitals. And review med history, if it's a patient that you see very, very often, you might see, let's put here we have cardiovascular, we have respiratory, we have all the possible, the top diseases marked by different things, and there's actually more button where you go neuromuscular, bone, skin, allergies, and other. Let's go back to cardiovascular, and let's say we have a prolapse valve. So we can put 2014 was diagnosed or something. And you'll see we can close that out. And you see you just wrote your first note. And now, so we're going to pre-med this patient with antibiotics. We'll go amoxicillin, 2 grams. And let's give some anesthesia. Topical benzocaine, save. Whenever you see the save button, you want to save often. And now let's go local infiltration because it's a maxillary arch, lidocaine, and let's do, say, 2 1/4 carpules. Okay, so you see how easy it's written. That little toast, that little black sentence writer up there lets you know that the sentence was written. Just a little positive feedback. If you want to take preliminary impressions, you can do it. Let's take 2 alginates, maxillary mandibular, and we'll close out. Now we have patient consultation and prosthodontics informed consent. Well, I'll tell you what. Let's go. Well, we're going to wait. I'm going to do that in examination. I'm going to go through an informed consent with you. And so here's what I want you to understand. You know, I was just debating. Well, should I use patient consultation? Show it to you. I'm going to show it to you in a moment in a different, just when we go through examinations. But patient consultation, you can see since we're not going to use it, you just skip it. And if you go through these things, you don't have to go through every little activity and every procedure. But if you want to, you can. So here we go. So STM stands for soft tissue management. It's management of soft tissue of any kind. So what are we going to do? Let's isolate. We're going to isolate with an Optidam. And are we going to do any soft tissue contouring? Well, if you wanted to, you could. We have electrosurge. And the reason is, the reasons for shape abutment sites, exposure into a margin, etc., and different ways to do it. Let's say we're going to hemostasis. Let's just use Gingipack if you wanted to, and any retraction. If you wanted to do retraction, you can do, let's say, a 0-0-1 technique. And you can even do chemical retractions here. So we'll go ahead and close that out. And let's go to crown design, types of crowns. Let's go to, anytime you see this little icon, you see a little molar icon underneath type, that's telling you that you want to press this tooth right here. Because the sentence that you're about to write is telling you, I need more information. I want you to tell me what teeth you're talking about. So here we go. Press 8 and 9, and we're going to make them Emax crowns, and we're going to save. And then let's go to retention options. Well, let's do adhesive cementation. Notice that there's no molar icon next to it, so you can just record a general sentence. And let's put a shade. Shade guide. We'll say basic is, let's say B1, light dentition. And let's save that. So we'll close this out. You notice how we finished everything on the left, and we'll close this out. Let's go next. We'll go to prep. And notice how it's leaving a little, if I go back and you see the gray, it tells you where you've been. It tells you what you've skipped. The prep. Okay, so the form, we'll say we looked at the occlusion. Yes, we did. Now here's a little icon. This makes for very elegant note writing. We're going to say 8 and 9. And we're going to put outline, resistance, and retention form. We analyze those things for crowns. You can even describe the margin that you place. Let's say chamfer. We're gonna. You can talk about reductions if you want. Let's say if you wanted to do incisal 2 millimeter reduction, make your selection. You see, it's asking you. So it's asking you. I have to make this selection. So because the little molar icon is there, so we're going to say incisal, and we're going to say 2 millimeters. There you go. Let me hit save. And so excavation. If we're removing restorations, let's say we removed restorations and there was caries. Caries was removed. And you can actually classify them now. Let's say 8, we could say was deep, and 9 was moderate. You can also record pulp exposure, etc., like that. With condition, we're not going to talk about, but let's say, and now we're going to go down to crack. Was there a crack? No. So, but if we did, you could record it, because I'll show you what crack looks like. Crack detected. You tell, let's go ahead and do it anyway. Crack was detected on 9. And we're going to hit save. It's, let's say it was location, let's say it was buccal, and it was traced horizontally. Let's say it was totally eliminated, and it was moderate in depth. So we'll classify it as a cuspal fracture. Okay, prognosis, we're going to say is good. And so the next thing we're going to do, let's go clean the preps. We'll clean them with chlorhexidine and water. You can also do mechanical debridement, etc., ozone or pumice. If you want to put a liner in, you can, but we're not, so we're going to skip that. We're going to do a core buildup on, let's say, on 8. So let's go to core buildup. Notice it's going to ask you what tooth. And we're going to say we are building it up with Core Paste XP. There's a lot of core paste there. And we can put shade. We'll put basic shade, I don't know, A1. And we will say its reason is to restore defect. Phosphoric acid, etch, let's etch Denton. And let's say we used, I don't know, we used tenure A and B. Light cure adhesive, light cure for 20 seconds. You see the little slider, and it's writing it. And you see how easy it is. Did we incrementally place or bulk? Let's say we incrementally placed. And we save, and then we light cure again, this time for 25. And there we go. So if we want to put pins in, you can see pins. If you want to, then we go ahead and refine. We'll add some refine margins, outline form, retention, and line of draw. So we hit save. So let's close this out. And now if you had to put a post in, you can put a post in. And there is build up and post also. And those are the kind of things you need to learn. Let's take an impression. We clean the impression again. Let's use Conceptus-based product, water, and then we will, if you want to do digital, you can record digitally. If you want to do trays, we can talk, let's say vinyl polysiloxane, and let's use a full arch tray, and we'll close that out so you can see it's being written. Let's look at provisionals. All right, so we have material, composite resin for provisional. I like to do that. Let's do something simple. Let's do ProTemp and shade B1. ProTemp B1. We'll save that and hit save. I'll save those. So methods. Let's use indirect matrix, and you can record a stump shade if you want. Provisional finish. Let's do the margins, the occlusion, the shape. We can surface glaze it and polish it, make it look real good. We're going to cement it. Let's say temp on clear. We take any additional records. Let's use. Let's take an impression and take photos of the provisionals. So there we go. We wrote this for 2 crowns. Now we still have the veneer to go, but let me show you how fast it goes now. So what do you have left? Next appointment. You have LabRx we closed down because we might get to that in the future, but if you go to it, you'll just see it's turned off. It's the only thing on the app that's turned off. We have try-in, we have placement, we have follow-up and maintenance. That's all next appointment. So let's go back and let's click on veneer. Since we finished all the requirements for our crowns, let's go to veneer. Now, do we have to go to pre-op? The answer is no. It's identical. So let's close it out. Do we have to go to patient consultation or prosthodontics? No. We have to go to STM? No. Do we have to go to design? Let's go to design because we're going to talk about veneer design now. And we're going to say we did veneers 4, 5, 6, 7, 10, 11, 12, 13. And we're going to say they're EMAX also. And of course, they're going to be adhesively cemented. You don't have to say that if you want, but if you want to, you can. Prep designs. We did occlusal analysis, and we also are going to record the teeth again. And you'll see we will say outline resistance retention form for veneers. So we also looked at the path of draw, and I actually use a shoulder for veneers, something called the vertical shoulder, which is pretty neat. You can look it up. It's something I invented way back 16, 18 years ago. So anyway, reductions you can discuss if you don't want to. If you have any excavation, if you had to remove restorations, we remove restorations, remove caries, and we can talk about, let's say if you want to, on, we'll say 6 and 7, we'll say we're moderately deep, just so you'll know. You could do a build up there if you wanted to, but we're not going to go through all that. You've seen how it works. We can clean the teeth again with here conceptus and water, and liner place core build up, and we can refine. So those are the things you can do. And now you are finished. So we took an impression. We already recorded that we did all that. We already made provisionals. If you want to talk about provisionals for veneers, it could be the same thing. It could be composite resin, and they could be Shade Guide B1, and we can go to, or you can use many other things. We go to methods. You apply a primer, a desensitizing agent, use an indirect matrix. Let's say we use a desensitizing agent, indirect matrix. Stump shades you can record. Again, provisional finish and polish and cementation. If you want, you can cement, or you can do direct bond like that. So records if you want. So all that's taken. Now that we've done that in crown and veneer, you saw how fast veneer went once you laid all the groundwork for crown. So that's how you work with multiple treatments. And that's why I showed you this one today. Now we just press conclusion. Now what can we do? We can give post-op instructions for fixed prosthodontics. Let's do verbal. Let's do for crowns, makeover, and veneers. And we can also do down here adjunctive. We'll do verbal for let's say local anesthesia. And so let's close that out. If you want to give meds, let's say you want to give antibiotics, you can record your prescription here. Amoxicillin 21, let's do TID, 1 refill. And it's that simple. It's just recorded now. So if we had to refer, you can refer. Let's go to the next appointment. And we're going to discuss, next appointment will be delivery. And we're going to put 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. And we can just put veneers and put delivery. And let's do 2 weeks and save. And there you go. So you can see now that we've finished that, we close out. And let's review the note, see what we've written. Wow, look at this note. Unbelievable. So let's read pieces of it. We have reason for visit, crown prep 8, 9, veneer prep 4, 5, 6, 7, 8, 9, 10, 11. Says the same thing in treatment. But you always want to record reason for visit. So, but here in our treatment, here's what we did. We did crown 8 and 9, prep, impression, provisional, veneer, and then we had 4, 5, 6, 7, 8, 9, 10, 11, 13 also. So crown pre-op, vitals were taken preoperatively, blood pressure 120 over 80, heart rate 68. A review of the patient's medical history reveals the following changes since the patient's last appointment: a mitral valve prolapse and diagnosis time. The patient was medicated with amoxicillin 2 grams. Benzocaine 20% was administered topically. 2 1/4 carpules of 2% lidocaine with 100 to 100,000 epi was administered via local infiltration. You can see how it works. Crown prep. His crown design, tooth numbers 8 and 9 were prepared for Emax crowns. The restorations will be retained by adhesive cementation. The core shade selection is B1. So the occlusion was analyzed preoperatively to determine the proper preparation forms, and tooth 8 and 9s were prepared satisfying outline resistance and retention form for crowns. So it goes on to say, and it even talks about the crack that we wrote about. A crack was detected at tooth 9. Location was buccal. It was traced horizontally, so the approximate depth of the crack is characterized as moderately deep, and it's a cuspal fracture. The prognosis is good, etc. So it goes on and on. Veneer design, we talk about veneer designs, the provisionals on both, and so you can segment as much as you want, or you can include it all in the same. So meds, patient was prescribed tonin capsules of amoxicillin 500 milligrams to be taken TID, 1 refill. So you can see what is how nice this note is written. Now the next thing that happens here is you have to go ahead and send it off to your practice management software. And that is done. This is going to be closed down, but there's something called a share sheet. And a share sheet, you have to create an encrypted PDF, which is what we will do. And but we're not going to send it because it's on a simulator right now. If it were on my iPad, I could send it. And we're getting ready to have what we call a master class coming up. And that's one of the things that we're going to talk heavily about is integration, because it's one of the biggest questions that we get. What the master class is, I'll talk to you about in just a moment, but we're going to be doing it not this, let's see, Monday the 31st. It's going to be November, I think it's November 6th maybe, or something like that, or 7th is a Monday. We're going to have a master class, and we're going to cover integration. So anyway, what we're going to do here is let's close out. So press the close button. And oh, one more thing. Let's go back to review. If you want to edit, there's edit, print, and then there's your share sheet. So if you want to edit, you can press the editing active button. And let's say you wanted to change, let's change the amount of amoxicillin we gave them. So let's go to pre-op, and we're going to swipe to the left with your finger and hit edit. And we will say, instead of 2 grams of amoxicillin, we're going to put 3, just for fun. And we hit close, and now you'll see it says 3 grams. And that's how you edit. You can edit anything you want in here. So once we finish that, you can go ahead and send it out. Now, once you send it out, nothing is saved on the iPad. It gets cleared. So if we go to clear, we're going to close the conclusion panel. We're going to clear data. And you'll see we clear all progress and everything's gone. So that's how you write a beautiful note. Now, that note will take me about 2.5 to 3 minutes to write, because I'm very fast at writing C notes. But to put that much information in 2 or 3 minutes is amazing. Most people spend 2 or 3 minutes writing, maybe 3 or 4 sentences on patient. But to get that kind of detail in 2 to 3 minutes we think is remarkable, and that's what makes C notes so special. So let's do something else. Let's put John, and let's get in. Let's say pain upper right side to chewing. This is one of these difficult things. It's like, well, where do I start? How do I write this note? It's like, I don't know what department I'm supposed to be in. Well, the department you're supposed to go into is exams. When you don't know, more than likely you go into exams because you got to diagnose something. So let's say the patient is having pain. We'll say 2, 3, 4, 5. We don't know, somewhere on the right side. So we're going to hit done, identify those teeth. And pre-op, if you want to go through pre-op, you see the pre-op looks a little different here. It's not a side panel. Here it's a little on the what we call a treatment view. And if you want to take diagnostic photos, you can. Intraoral, extraoral, save, impressions. You can do maxillary mandibular, alginates, and you can take x-rays. So let's take a periapical x-ray. So we're going to hit this, and we're going to hit 2, 3, 4, 5, and we're going to hit periapical. So this is the teeth we covered. And let's close out. And now in here we have periodontal exam. We have dental conditions exams, we have endodontics exams, we have pedo exams, orthodontic exams, we have facial aesthetics exams, TMJ, we have cancer screening, we have implants, all these things, and then we have new patient findings. It's like a diagnostic thing. So let's go into perio first in these 3 areas, and I'll show you how we are going to discuss pocketing. Let's say if you want to discuss bleeding or anything periodontal related, but let's go straight to pocketing because we're getting a little low on time. And what I'm going to do is I'm going to I'll scroll this up, and you'll see it's looking at surfaces. So let's discuss what we find just in that area. So I'm going to put 2, 4, 5. And what we found was distal buccal, distal lingual, mesiobuccal, mesiolingual. And we're going to put all 3 millimeter pockets. How's that? So we hit save, and now you see it recorded all those pockets at one time. Let's go to number 3. And we're going to say, well, on the distal buccal and distal lingual, we had a 6 millimeter pocket. So we know something's going on. So there you go. And if you wanted to record 3 again, you could say mesiobuccal, mesiolingual, we're 3. So we know distally on this tooth something's happening already. And you can talk about recession, you can talk about mobility, stain, all the same way, calculus, attached gingiva, plaque, all that stuff. But let's close this out. So now that we finished that, let's go to dental conditions. Well, what do we see? Well, let's say we see, first of all, amalgams. So we're going to hit amalgam, and I'm going to hit 2, 3, 4, 5. All the teeth in that area have fillings in them. So let's see, here we go. It's asking you, tooth number 2, let's say it's occlusal, and commit. Tooth number 3, MOD, let's hit commit. Tooth number 4, let's do OL. Tooth number 5, let's do OB, just for fun. And so you can see it wrote those already. So let's hit, what else can we find? Well, let's say, for example, we notice that there is a fracture. Let's say the amalgam, failing amalgam, and it's tooth 3. And we'll say it's occlusal is where the fracture is. Now let's put distal 2. And so we know something's going on with that tooth. And let's say we see a fracture. 1, 2, 3, and we'll say it's OD. Now, so we get out of here. Let's go to endodontics, because now we're looking at symptoms. Well, we have pain. We press symptoms, we hit pain, and let's say it's constant, it's lingering, onset was, let's say, 2 days ago. Like I said, I'm not a good typer, y'all. 2 days ago, hit done. And location, it's localized. It's provoked by, let's say, chewing. The intensity is moderate. So you see all these things? Swelling. You can also denote that there's no swelling. We'll say there's no swelling. So we'll hit close that out. We're finished with that. Let's look at the radiographs. Now you notice we recorded that you take a radiograph in pre-op. Now we're going to talk about it. You talk about radiographic analysis in endo. So let's say, for example, we're going to say tooth 3. Notice you see a different grill. It's an endodontic grill. That's what we call these teeth affectionately. We call them grills. So we have, let's say we see a, I don't know, let's see a periapical radiolucency there. It's like, okay. Now at any time, you can record external, internal resorption. You can record focal, lateral, and vertical bone loss. So let's say we can do that. And we'll hit save. And at any time, you can also highlight this again and put caries there. And let's say we have, well, you can make a diagnosis on this right side at any time. So we're going to say it's a LEO, a lesion of endodontic origin. And we'll put, we got to make our selection. And then we'll put lesion of endodontic origin and hit save. So it's recording these things. Now you can do other things. You can record cold tests, and you can do, the way you do a cold test or a heat test would be identical. Watch, I'll show you how to, I'm going to hit 2, 3, 4. And we're going to say tested normal. We're going to say tooth 3 is going to, let's say it's moderate and delayed. And we're going to hit save. So that tells you how you conduct a cold test or heat test. We also have pulp test, transillumination, perio probing, selective anesthesia, tracing sinus tracts, etc. You can all record that information. So let's get out of there. And so do we have to go any further? No, we kind of know that we have an endo issue. So we have a lesion of endodontic origin. So now we've diagnosed this patient who's in pain. We have to tell them that that they're going to require a root canal in order to fix this tooth. So let's go to endo, and we're going to hit root canal as a treatment selection, and we're going to hit tooth 3 and hit done. Now let's go to root canal. Now, do we have to go through pre-op? The answer is no, but do we have to go through patient consultation? Yes. Let's go through consultations and why this is so important, and then we'll finish up. So present at the consultation, you want to record who was there. Let's say the patient and the dental assistant, including yourself. proposed endodontics, root canal. Let's go to patient conditions education. We're going to talk about the infection that we see. We're going to talk about deep decay, repeated dental procedures, cracks, and pulpal inflammation. All this is creating her issue. What about treatment purposes? To remove infection, save the tooth, remove the pain source, and improve the restorative result. Local risk factors. We could say there's none, but there's poor hygiene, lack of professional cleanings, failed restorations, all these things you want to talk about, caries. What about systemic risk factors? We could say there's none on this patient. Treatment options. Well, you can root canal and crown. You could extract an implant, that kind of thing. If you had a crown, you could say recrown, retreat, etc. So treatment discussion. Let's talk about the treatment of pulpal tissue. Let's talk about chemical therapy we'll be using. What do we do in clean and shape? We don't talk about external filling methods or bony defects to repair. We'll talk about endodontic outcomes and healing times. What about operative risks? Well, you could have some bruising, you could have some swelling, you could have some post-op pain, you could have an infection, you could have an antibiotic reaction, that kind of thing. You have discomfort, hypersensitivity, and also you got to talk about possibility of tooth failure. Non-treatment risks. Well, you can have morbidity, you can have tooth loss, pain, caries, aesthetic compromise, restorative compromise. And if it's a front tooth, is why you put psychological implications. So it may require further treatment. You may have to go in and give some more antibiotics. You may have to do a procedural retreatment. You may have to do some kind of surgical augmentation, like you might have to extract. You may have to alter prosthodontic treatment, etc. So these are all the things. Now, what we just did was we just talked to the patient. Now this becomes what I like to do with patient consents is I like to hold the patient consent. I read it. I discuss it with them as what we let you know. It's kind of like a checklist, let you know what you should be talking about. So as we have John, and if you want to put date of birth, the guardian name, basis of guardianship, etc., you can do that. So what we have here is in this consent form is that's just been created. It is written based on what you just discussed. For example, I was informed of my pathological condition. Proposed treatments include benefits of proposed treatment, risks of non-treatment, alternatives to treatment therapies were discussed. And it says, I hereby give consent and direct Dr. J.S. assisted by dental auxiliaries to perform root canal. Let's talk about some of the things that we talked about. The consultation focused on causative factors of endodontic treatment as it relates to my condition of infection, deep decay, repeated dental procedures, cracks, and pulpal inflammation. So you can see how nice this is. Now what happens is, what I want you to do is you swipe to the left, and all of a sudden for every line, every paragraph you see here, you want the patient to accept it, edit, or decline it. If they decline it, you decline treatment. It's that simple. So they go through and do each one, and when they're finished, you hit patient signature, and they can sign, and then we save signature, and that gets saved, and also this can be printed. So we go ahead and save this, and we're done. And so that is the beauty of having patient consultation and informed consent. So if we go to conclusion and review the note, you can see what we have here. Pain, upper right side chewing. What we did exams, pre-op, perio, dental conditions, endodontics, root canal number 3, patient consultation, endodontics, informed consent. So it shows you how nice this is. We do the treatment up top, so you can, when you go to review your notes, you can look at it real quick. Looks at all the periodontal, the perio, the dental conditions, the endodontic conditions, everything that we see. Then we talk about patient consultation for a root canal, and you see all this information that we talked about is in the patient consultation notes, because most of the time you write about a patient consultation in your notes. What do you put right now? Consultation with Mrs. Jones about root canal therapy, and that was it. So here we discuss everything, and all this is translated into a consent form that can be printed, and they can sign it, and it follows the patient. So that's the beauty of it. So let's close out of here. Now, so it gives you an idea of how C-Notes works and the detail with which we work. So we'll clear this data. I'm going to go back to, let me go back here one moment. There we go. And let's see, screen share. All right, so that's my at the end of our lecture for Centric Notes, but I want to talk to you real quick about C Notes pricing in case you are interested, because we appreciate you guys spending an hour with us today. And we do this for every webinar we've done since July. And I'll tell you, our regular price for C Notes is about $480. But that's an annual rate, and that's a subscription for 1 year. But we've been having an intro sale since February, and that is it's about $360. So it's 25% savings is what we've been offering people, because we're trying to get people in as early adopters. You guys, like I said, we've only been around a short time, but we think that what we have and what we do here is really, really important for dentistry. So we want to get people in, try to get them in at a low price, and which equates to about $30 a month. Now, with regards to, you also have the opportunity right now to have a month-to-month subscription. I will tell you that in the near future, we're going to be getting rid of it, but for right now, we still have it. And the only month-to-month that we will allow will be a 1-month subscription, just to see if you like it, that kind of thing in the future. But we're trying to get people off of it, actually. But we want you to, so this is what we have right now. But since you're here today, what we also have is a webinar special. Now, and that is about $288 for a yearly subscription. And that's a 40% savings on regular C Notes subscription. Now, here's the thing. We're also going to give you an extra lock-in special for being here today and taking this interest in C Notes, and that's, we're going to give you 40% off for life. That's the life that you own the product, the life that you have the subscription. It'll always be $288. It will never go up, never change. It's just for these special early adopters, so it'll never be this low again. Now, here's the thing. This offer is ending next Friday. That's the last time we're going to offer this. Next time we have a webinar, it will not be this cheap, so this is actually the last time you'll be able to do it. So we want you, there is a, if you go to sign up on our website, you can use a coupon that Scott will give you if he hasn't already given it to you yet in the chat room. And I think it's C Notes Webinar in all caps is what it is. But so today's webinar special, what are you going to get? You're going to get the C Notes app for $480. You're going to get for $288. The C Notes one-on-one consultation, which I highly recommend, because it's how everything that I showed you today, your head's probably swimming saying he's moved too fast. But even I'm going to go over with you and your staff if you want to cover hygiene, everything, so they can be using the C Notes also. And so if you want to print or go digital, you can. But it's that missing clinical interface that we feel like we're providing for people. So we're going to spend 45 minutes to an hour with you and your team to make sure that you get you off the ground of C Notes working very easily and show you all the ins and outs of it. So we're also going to allow you to have these master classes, which is valued at about $1,450. And these master classes, we spend an hour, about an hour a month is what they've been averaging to have you learn how to use C Notes. We cover basic things. Like I said, the next one's going to be, I think, November 5th or 6th or something like that. And it's going to be on integration. So now also we lock you in at 40% for life. And like I said, this is all ending on Friday. So the value is $2,500 plus, and we're giving it to you for $288. So we hope you join us, join the C Notes family. We are very passionate about this, and we also think that it's very good for dentistry, and it's good for your practice. It'll make you feel much better knowing that your notes are well written. Even sometimes, at the end of the day, I'll tell you, like this past week, I was so busy, and thank God, because sometimes the way the nature of dentistry today is, it's hot and cold, hit and miss. And so we had a very busy week, and at the end of the day, you're dog tired. And what's so important is you don't feel like writing detailed notes because you just can't think. You're spent. And with C Notes, you go in there and you look button by button at what you're going to do, and you don't have to think about writing the notes. You're going to say, yes, I did that. Yes, I did that. No, I didn't do that. Yeah, I did that. And that's how you write. You don't have to begin by thinking of the whole note in your head. You just begin by saying, yeah, I started off with a root canal, or I started off with a consultation, or I started off with examination. And as you go piece by piece, you'll figure it out. And as time goes along, you'll be able to write them very quick. So anyway, Scott's in the chat room, and if y'all have any questions, we'll be happy to answer. And so we thank you for attending today and hope y'all have a blessed weekend.